QFix offers a variety of thermoplastic solutions for customized head and neck radiotherapy treatments. We're the inventors of Aquaplast RT, the most widely used and trusted thermoplastic material worldwide, and Kevlar reinforced fiberplast, the most rigid material available. Combined with a Q headrest and mold care cushion, QFix thermoplastics are easy to form, rigid, and highly resistant to shrinkage, providing accurate, reproducible immobilization, making them the ideal head and neck treatment solution. We will now demonstrate the techniques for making a U-frame and S-frame variable perf mask. Variable perf pattern provides strength where you need it most, maximizing rigidity while minimizing the bolus effect. Turn on the water bath before the patient enters the simulation room, making sure the water is deep enough to fully submerge the thermoplastic mask. The recommended temperature for softening Aquaplast RT is 70 to 75 degrees Celsius. However, because fiberplast hardens quicker than Aquaplast, we recommend a forming temperature of 75 to 80 degrees Celsius for fiberplast. We will now demonstrate the use of a Q2 headrest and a Mold Care U head cushion as they have been optimized to work together. To install the Q2 headrest, place it onto the small pins located on either side of the head portion of the device. Once the patient is centered properly on the Silverman, you can now begin forming the mold care. This cushion custom forms to the patient's head and neck, reducing movement in the x-axis, which improves head, neck, and chin positioning and ensures reproducibility. To begin forming the cushion, spray it approximately 6 to 12 times with room temperature water. Knead the cushion to distribute the water evenly, and then flatten it on a hard surface to expand the cushion and remove any wrinkles. Lift the patient's head and place the cushion onto the Silverman so that it is slightly inferior to the cranial stop, and depress it into the indexing hole to ensure reproducibility. Position the patient so that the crown of the head touches the cranial stop of the headrest. Use the longitudinal lasers to confirm that the patient's head and torso are once again centered on the device. When forming the cushion, remove any gaps under the patient's cervical spine. This also helps to index the mold care cushion into the grid region of the portrait head and neck device. Shape the cushion to support the sides of the head, ensuring it does not extend past the base of the Silverman, so it will not interfere when forming the mask to the device. Continue to hold the mold care in place for approximately 5 minutes as it hardens. Begin forming the mask by placing it into the water bath, allowing it to soften for approximately 2 minutes. Remove the mask from the water bath and blot off excess water with a dry towel. Make sure the mask is dry and cool enough for patient comfort before proceeding to the next step. If you are using the AccuFix cantilever head and neck device, begin by hooking the edge of the thermoplastic under the patient's chin. Stretch the mask down over the patient's head, making sure the thermoplastic on the bridge of the nose is placed in the proper position. Then secure the mask on the device by tightening the swivel locks. If you are using an S-frame portrait head and neck device, stretch the mask down over the patient's head, again making sure the reinforced strips are located over the proper anatomical structures of the patient, especially the bridge of the nose. Press down on the locking pins to secure the mask to the device. Now finish molding the mask, using gentle finger pressure to achieve the desired contour of the patient's head, as well as the contour around the nasal arch. The forming of the mask is now complete. You should always allow the mask to cool completely before removing. Our mission is to optimize patient outcomes by providing clinicians with innovative and efficient positioning and immobilization solutions. Our products ensure that the patient has a comfortable experience through every step of the process. Please refer to the QFix website at qfix.com for a complete list of solutions for your radiotherapy patient positioning needs. QFix, positioning patients for life.